Hello. Hi. Welcome to Medical Pearls, the series of video presentations packed with hail and hearty words of wisdom, designed to empower the knowledge of the general public on remedy and malady. Presented by Dr. Ranjith Peiris, General Practitioner, Family Physician, former United Nations Physician.
Under the major topic of ROLLBACK COVID, and under the subtopic of necessity of eye protection with COVID-19. Summary of the presentation. 1. Eye remains as one of the three key entry routes of the COVID-19 into the human body. 2. Pink eye is not uncommon with COVID-19. 3. Transmission of COVID-19 via tears is possible. And 4. Eye symptoms may coexist with severe COVID-19. The SARS-CoV-2 virus, that is responsible for COVID-19 pandemic, is a RNA virus that has a spiky protein on its capsule. And these spiky proteins can bind with receptors, or cellular doorways, that are found in specific cells and tissues of the body. These particular receptors are known as angiotensin-converting enzyme 2, or ACE2 receptors, and found in the tissues and cells of the nose, mouth, lungs, kidneys, liver, intestines, heart, blood vessels, certain parts of the brain, and immune cells. In the eye, these ACE2 receptors are also found in the conjunctiva, cornea, and retina. These ACE2 receptors have a protective effect on tissue injury, and the binding of SARS-CoV-2 viruses with these ACE2 receptors unfavorably affects the cellular protection. The recognized symptoms of COVID-19 are cough, runny nose, fever, headache, bodily pains, easy fatigability, difficulty in breathing, sore throat, loss of smell, loss of taste, poor appetite, abdominal pain, and diarrhea. The sudden onset of eye complaints such as pink eye irritation, increased tearing, sensitivity and intolerance to bright light, etc., are less recognized symptoms of COVID-19. In a limited study done in China, nearly 30% of COVID-19 patients had symptoms of pink eye, but in about 90% of those patients with pink eye, had other severe symptoms of COVID-19. The coexistence of eye symptoms were more likely than those without eye symptoms to have abnormal blood results such as higher levels of white blood cells, neutrophils, procalcitonins, C-reactive proteins, and lactate dehydrogenase. Therefore, the coexistence of pink eye with COVID-19 may be a warning sign. Although pink eye itself is self-limiting, there are multitude of causes of pink eyes, other than due to COVID-19, and the commonest causes are due to different types of viruses, bacteria, chemicals, and allergens. But in the presence of other well-known symptoms of COVID-19, closer association with COVID-19 patients, and also during an established period of community transmission, the symptom of pink eye may be a symptom of COVID-19. The transparent slimy covering, or the mucous membrane over the white surface of the eye and inner eyelids, is known as conjunctiva. Inflammation of this conjunctiva is termed as conjunctivitis. The eye serves as one of the three important entry routes of the COVID-19 virus into the human body, in addition to the nose and mouth. The mucous membranes of the eye and the cavity of the nose are connected via the nasolacrimal duct, or the tear canal, which is located near the nasal side of the eye. The internal connection between the cavities of the nose, mouth, and throat is also well known. The eye, nose, mouth, and the throat are also connected with each other through their mucous membranes. The taste of certain eye drops are felt few seconds after their installation into the eye. This phenomenon may be the simplest way to understand the connection of the mucous membranes of the eyes, cavities of the nose, mouth, and throat. Therefore this virus, once it had invaded the eye, can migrate towards the mucous membranes of the nose, mouth, throat, and finally into the lung tissue. This virus continues to multiply in these organs, including the lung. The secretions from the eye also serves as a vehicle in the transmission of this virus into the others, but so far the possibility of isolation of SARS-CoV-2 virus from the tears is as low as 2% to 3%. This may be due to the low preference of the COVID-19 towards the ACE2 receptors of the eye. But the percentage of pink eye symptoms in COVID-19 patients may vary between 5% to 30%. Sometimes in about 1% of patients, the pink eye may be the only presentation of COVID-19. So far the eye symptoms of COVID-19 were self-limiting, and there were no reported instances of permanent visual impairments. Therefore the wearing of either spectacles or sunglasses are also encouraged in the prevention of COVID-19, in addition to quality face masks. Healthcare providers are well advised to wear N95 masks, goggles, and face shields. In a research paper published in JAMA Ophthalmology, it was disclosed that people who wore glasses were less likely to be admitted with COVID-19. Therefore the eye protection remains as one of the important components of PPE, or personal protective equipment. These measures on eye protection are, in addition to the other well-known guidelines, in the prevention of COVID-19. It is very important to refrain from rubbing the face, eyes, nose, and the mouth with dirty hands, but this is a hard habit to break. The masks, spectacles and goggles also acts as deterrents in the prevention of the hands and fingers touching the nose, mouth, and the eyes. If you must touch your eyes, use the inner side of the upper arm or the shoulder instead of your fingertips, but a good alternative is to use disposable facial tissues and the safe disposal of it. Moistening eye drops may help to ease the irritation of the eyes. Wash your hands at least for 20 seconds, before and after touching your eyes. It is much advisable to postpone the routine eye examination for 1 to 2 months during the corona pandemic. It is a wise step to stockpile the routine eye medication, such as the glaucoma eye drops, and regular eye medication, for a period of 3 months. Avoid touching the eye with the tip of the bottle during installation of the eye drops. If the tip of the bottle gets contaminated with the eye, clean the tip of the bottle with alcohol or discard the bottle. Single-use eye drops are much more preferable over multi-dose vials during the current pandemic. The contact lens wearers are also advised to switch on to spectacles. It is also recommended not to use cosmetics around the eyes, as an additional preventive measure. The end of the video presentation on necessity of eye protection with COVID-19.
Thank you for watching. If you like this video, please give us a thumbs up, subscribe and share.